There is so much to break down from this clip I'm about to show you from the VA Secretary's very last press conference, the VA Secretary McDonough under the Biden administration. So let's go ahead and watch this and listen, that's key, on what the VA Secretary has to say and why he mentions many things. And one of them is getting rid of VA primary care physicians. And so this is a big one. So pay very close attention to what's being said, okay?
If it continues to expand at the rate it has over the last several years, I'm hoping, Secretary, that you can sort of walk me through the consequences of that and how veterans who do seek direct care in the VA, how they might be impacted. Thank you so much.
So her question is about community care expanding, because if it travels along the same path, it's going to grow too big. And so that's the question, right? Budget's at hand, that costs money. So we're about to see the VA Secretary's answer here.
Yeah, so it's always,
sweet
I think, treacherous to respond to a question that starts with if, because it is hypothetical. But let me just talk, rather than about the hypothesis, let me just talk about kind of how the system works, right? Because ultimately, how we fund the reimbursement to community providers comes from the same pot in the budget for how we fund, for example, the people we hire at VA. And one could see a period at which the demand for care in the community, for funding for appointments in the community, is so significant that that you have to pull back on the amount of the budget you're dedicating to hiring and maintaining VA providers. And so then the question is, if that is indeed a choice that we make as a country, that I
want to address something, because what he said is masterful here. He doesn't want to insinuate division. He says, if we indeed make that choice as a country, all right, we're clearly talking about Trump's VA administration here, moving more towards a privatized VA through Complete Demission Act, which is doubling down on community care. And what the VA Secretary is talking about is, if we're paying community care providers, do we have the funds to, one, continue to do that? And if we do, or if we don't, it's got to come from somewhere. And so where does that money come from? That's where we're at right now.
Would reduce the number of providers at VA, how would we do that? And what would be the rational basis for that? Would you just say that, VA is going to get out of certain specialties? Would you rather say that VA is going to maintain the specialties but get out of, primary care? Each of those would end up creating a different scenario for veterans. And each of those has significant costs. And so, when I said that, that we have to decide what, as a country, what we want the VA to look like, I think we should have a straightforward debate on that. The debate to date has been a suggestion that somehow we're limiting access to care. I think that's patently, fundamentally, overwhelmingly inaccurate.
That part's true. The media has created the narrative of exactly what he's combating. So that part I can get behind.
I'm very proud of the way we, as the country's leading healthcare provider, the way we've provided robust wraparound care, integrated care for our veterans. And community care has been a key part in how we do that. So the debate isn't a fair debate is not a question of whether VA is denying access to care. A fair debate is, what do we want that care to look like for veterans in an integrated healthcare system over time, and how do we finance that? And I think
Okay. There you go. How do we finance that? That's really the key here, and something to think about. I think both options suck. Okay. If you go full on community care, full on contracted healthcare away from the VA, there's some plus sides to that, right? Assuming you get your appointments faster, that's essentially what community care is for. Downside is appointments come and go, right? Like if everyone's using community care, you're going to have the same appointment issue that you have now. Maybe I'm not a healthcare expert. Okay, these are just my thoughts. Then if you take away community care and go full on VA, you're definitely going to have appointment issues. That's why community care was created in the first place, is to alleviate that. Now, community care, VA healthcare, all this stuff costs money. And what I'm trying to explain is I don't care if you go this way or that way, they're both going to suck. Right now, we had this middle ground. We see the Trump administration really lean towards going heavy onto the community care side. I'm not saying that's good or bad. What I think the VA secretary is getting at, and this is the point I'm trying to make, is both options have plus sides and both options have downsides, and they both come with a cost. Now, he mentions one thing, and I want to be very clear about this. It's not about providing healthcare to veterans. That's going to happen. He mentions what's that going to look like? Is it going to be this hybrid version of what we have now? Is it going to, hey, no more primary care, no more specialties, no more whatever the VA decides to do? What does that look like? That's in my opinion, the biggest challenge for the Trump administration to figure out. If they go that community care route, is what is that actually going to look like? Let me know your thoughts down below in the comments. This is obviously VA secretary, VA healthcare. How do you run veterans healthcare? I'm no expert. I'm just a dude in his basement. But someone who uses VA healthcare, I can tell you that I've waited about 2 months to see my primary care. Now it's something urgent, nothing I wanted to go community care for, but I'm waiting 2 months for mine. So that kind of sucks. Anyways, let me know your thoughts down below. This is a big one here. How are they going to cut costs? I don't know, but I do know it's going to suck no matter what they do.